Mental health is integral to overall well-being and is crucial to personal, community, and socioeconomic development. Caring for your mental health tonight on Call with the Prairie Doc. Good evening. I'm Dr. Debra Johnston, tonight's Prairie Doc. Thank you for joining us again as we continue to provide information based on science and built on trust. Tonight we're discussing mental health. Joining us in the studio here in Brookings are Dr. David Ermer and Dr. Wallace Jackmon, both from Avera Medical Group Behavioral Health in Sioux Falls. Welcome, gentlemen. I'm so happy you could join us here tonight. And even if you're not getting to watch the Jacks game, it's at least you're here on campus. Dr. Ermer, I'm going to start with you. Can you tell us a little bit about yourself and your specialty?
Sure. I'm Dave Ermer. I'm a child and adolescent psychiatrist specializing in mental health care for children and adolescents. Went from a small town in Nebraska, went to school in Nebraska, and then residency at KU. Been in Sioux Falls since 2000. Worked different group homes, kids with developmental disabilities, and currently I'm the clinical vice president for behavioral health at Avera. But
still seeing kids too,
yes.
Doing some clinical work.
Kind of, yeah, half and half now.
Half and half. Wear a couple different hats now.
Yes.
Mm-hmm. And Dr. Jackmon, you wear a couple different hats too. Tell us about you and your role.
Well, I started off at Augustana College as the degree in social work, and I finished up my master's degree at University of Nebraska, Omaha, and started off working at the Mental Health Center, worked at Charter Hospital, worked at a couple group homes, and primarily I've been here at Avera for about there in Avera, Sioux Falls, a little further south, at Avera for the past 24 years. I'm a licensed clinical social worker, licensed clinical psychologist, and I moved into the psychology director position at Avera, where I'm doing more administrative duties about half-time and half-time clinical work. Primarily I see adults. I cut my teeth in working in child protection and working with families and children initially when I was at the Mental Health Center and at Charter, but I primarily see adults now on an outpatient basis.
Okay, so both of you do a little bit of a lot.
Yes.
So, yes, wonderful. Before we start our conversation, we invite you, our audience, to submit your questions about mental health. We look forward to answering your questions. Viewers can contact us one of three ways. Call 1-888-376-6225. Send an email to ask@prairiedoc.org or ask on our Prairie Doc Facebook page. We'll work to answer as many of your questions as we can given the time we have available. Sometimes we receive more questions than we can cover, and we apologize if we don't get to your question. To encourage you to ask early, all questions asked in the first 20 minutes will be entered into a drawing for our newest Prairie Doc publication. The winner will be announced at the end of the program. Your questions will remain anonymous, but please provide contact information when you submit your question. And we've already started getting questions even ahead of the show, which is so exciting. So let's get into it. So we have a question that came in by email. Someone says that they were told they need to reduce the stress in their life because of the potential health concerns that it's causing. What types of things should they be doing to reduce stress? Dr. Jackmon.
Well, we always talk about the mind-body connection, and so if you have a mental health, cognitive thinking problems, it can affect your body, such as, example I might use is somebody has a trouble with a test that they have to take at school. Well, that could cause a stomach ache, or I don't feel good. Then when I don't feel good, I start to worry about the stomach upset or whatnot. So there's a connection between the mind and body. And so it's not uncommon for there to be health-related issues that are going to cause distress for folks. And so it's important for individuals to speak with individuals that might be able to help them with some of their stressors, maybe a counselor or a doctor, a primary care physician, and focus on the areas of their life that might be causing them more distress.
Dr. Ermer, anything to add?
Yeah, I kind of dovetail off of what Dr. Jackmon said, in that I think the goal shouldn't be to reduce stress in our lives. It's the goal is going to be to develop strategies to deal with stress. So then you're not so vulnerable. You can wake up in the morning and know, hey, the world can throw a lot at me, but I've got some tools to use. Professional people can help, but other things like exercise, do things you can control, like exercise, watch what you eat, get enough sleep. So I think, it is good to reduce the stress in your life, but even better is develop strategies if there is stress in your life, you know how to deal with them.
Mm-hmm. And I think that's where working with a therapist, a counselor, can be incredibly valuable in helping you identify what tools should I be working on.
Correct. I mean, some of the stressors could be environmental stressors. They could be familial stressors or relationship problems. Sometimes folks don't even recognize the things that are causing them the distress. It might be a physical manifestation of a person biting their fingernails or not sleeping well, but not clear as to what are the specific things, either in their environment, their work, their family, that is causing them distress. Other people might be able to point that out, including maybe a therapist or a physician.
Yeah, absolutely. I think those are really important things to think about. I think some of us, it's like the old story about the frog that you boil. If you turn the water up slowly, if you turn the heat up on the water slowly, you don't even recognize the frog boils to death. If you dump it in the boiling water, it jumps back out. So very, very useful. So we have someone from Facebook who's wondering about some of the goals and priorities that they should take when they're working on their mental health to try to keep positive, to have a positive impact on their mental health. And Dr. Jackmon, you had talked a little bit when we were talking to the students before the show about some of the things that you've noticed having a real detrimental effect on people's mental health.
One of those is social media.
Yes.
Unfortunately, I'd be doing a disservice if I didn't at least mention that to folks, that the impact that the negative components of social media can play a role in increasing the likelihood of one's anxiety and depression. There's some research that indicates that if a person is using 7 or more platforms of social media, it increases their risk of anxiety 3 times as high. And so if a person is using far too much social media or looking at negative news posts and those kinds of things, definitely that would be an area of concern and an area that they might want to track how much time that they're spending on social media. Yet I think the question revolved around goals of what they can do to cope with their distress. Is that accurate?
And just to kind of promote positive mental health, to help protect and keep themselves mentally healthy.
Yeah. I mean, the one possibility is the social media. Keep attention on that. Their health, their physical health, that's important. What type of diet, are they eating properly? Eating, the same 3 basic food groups. People know what types of things. Drinking plenty of water, exercise, keeping a good feel for how well they're doing that each day. And I'd also say sometimes folks will develop goals, but they're not realistic goals. Like, I just need to feel better. Well, how do you know what feeling better means? So that you want, whatever goals you develop, you want to make sure that they're realistic and preferably something that's measurable, that you can measure that you're actually getting those things accomplished in an attainable amount of time, not something that's 1 year out, something that you can attain realistically, that's measurable within a shorter period of time, so you feel like you're making some changes.
Mm-hmm. Agreed. And I also think if you do make those goals, we goof up. We have a bad day. Don't beat yourself up. If you, like, I want to eat better, but today, it was a birthday, I had a bunch of cake or something, It's okay to not be perfect. And I think sometimes people develop these goals. Hey, I got to exercise. Oh, I didn't make it today. Hey, it's okay. You've got these short-term goals. You've made some progress. No one's perfect. And I think there's a sense of, like, it kind of goes along with Dr. Jackmon's talk about the internet, maintaining a sense of optimism. There's a lot. It's not saying you should ignore all the ugly things happening in the world, but because there's plenty of ugly things, but you don't have to dwell on them. And I think sometimes you get on the internet and you can go down that rabbit hole and get just stuck on all the negative things happening in the world, whether it be politics or war or whatever, economy. I think you can find optimism every day in something, and I think that's really to try to find something to look forward to and be optimistic. And it takes practice. You can't just say, I'm going to be optimistic today.
Right.
It's like Dr. Jackmon said, maybe you need a therapist to help, or just, you got to practice, hey, I'm not going to focus on the negative. I'm really going to focus on, being thankful, that gratitude or being optimistic is a real thing that you have to practice on, and it's going to take a while to do that. And once you start doing it, it becomes automatic, and then you wake up, looking at the world in an optimistic manner and being grateful for the things that are going well.
Yeah.
Like Mr. Rogers said, look for the helpers.
Yes.
To look for the positive responses to the terrible things that you read about, and that can be a useful thing. So we have a caller wondering about some of the resources that are out there to help people in an immediate mental health crisis. Dr. Ermer.
Oh, that's a great question. There, obviously 911 is always a call you can make if you don't know, or if you're in a certain area. But emergency rooms, I think there's the new suicide hotline is available, that phone number, and then
that's 988, isn't that correct?
Yes.
Yep.
And then Avera, for instance, has an mental health urgent care that runs 24/7, and that's available too, and you can talk to somebody. And so there's resources out there. And I think in a crisis, if you don't remember the numbers, everyone remembers 911. They will definitely guide you to the right place. Right. I think it's better to be safe. You're not going to bother anyone by calling that number.
Absolutely. I think that's the number one thing. You need to stay safe, and then we can work on helping, getting what what resources you need to be connected with. But the first thing we have to do is keep you alive.
Right.
And I would add to that that people can't be afraid of asking for help. Sometimes they're fearful that they're going to be a burden. Whether it's asking for help from their father or their mother or their pastor, or even calling 911 asking for help, that they feel like they're being a burden or their issues aren't that important. And I just say that shows us some wisdom, that you know that you need some help and you're reaching out to ask for that help. So that would be the thing I would kind of stress to folks, that don't be afraid to ask for that you need some help with something.
That's a really important message, and it dovetails really nicely into the next question that somebody had emailed in. How do I bring up my mental health concerns with my primary care visit? I'm embarrassed to talk to them about it. Dr. Ermer.
And I could probably throw it back at you, but I think you want to hear about it.
I want to hear about it.
You want to hear it. You're not being a burden. You want them to be honest with you. You just straight up. If you're having suicidal thoughts, bring it up.
Yes. Mental health issues underpin at least 90% of the visits that I have with my patients, and some of them are very aware of that, and others are less aware of how much the mental health struggles that they're having play into their physical health. And even those people where, we're looking at your diabetes, we're looking at your blood pressure, we're looking at these, what we consider objectively physical things, a lot of people have mental health issues in addition, and it is a very normal part of my day-to-day practice, and everybody has struggles, and I want to hear about it. And I think I speak for most of my colleagues that we may not be able to give you the help that you need, but we can help you find the people who can.
That's a good point. I'd add too that folks that often don't want to ask for help think that they might be the only ones, that no one else has an issue like this. People think it's weird or it's strange, and research clearly supports all of us in the field either have someone in our family or we have experienced some of the same things that those folks have experienced, whether it be depression or post-traumatic stress or trauma. A majority of care that's part of the reason we might have gotten into the field, is because we were able to overcome some of those things, and we want to be able to help other people. So that's the thing I'd encourage folks to think too, is that you're not the only one. Some of the providers that you're approaching, including your family practice physicians, likely either have someone in their family or know someone, or they've experienced some of those things themselves.
Absolutely, and it's just so prevalent in society. And to speak to the social media, you see such a distorted view on social media. You know, it's such a curated view, and people are presenting this perfect life.
Oh, absolutely.
Or this, you know, really distorted vision of what mental health care is all about. And you know, remember that's not real.
Correct.
And
Well, it's such their physical appearance, their activities. It's not real life.
No.
And but people, especially young, I see that in adolescents. They think, oh, this is how everybody is, and I must be the only person who doesn't look like this, act like this, or
feel like this.
And so I think it does distill down that idea that a lot of people are struggling.
Yes, it is very, very common. So. Hearing the word cancer usually brings intense emotions like shock and anxiety. Support groups are available to help patients with the many complex feelings that come with cancer diagnosis and treatment. Prairie Doc reporter Sam Shower spoke with Monument Health's support team about their support groups and the benefits to a patient's mental health.
Mary Ann Fredrickson is a patient support team social worker at Monument Health's Cancer Care Institute. She is one of 2 social workers who help patients with their mental health during their cancer journey.
Right off the bat with their diagnosis, that can trigger a lot of anxiety, fear, anticipation, all of this kind of around the uncertainty of what they're about to go through or what they're coping with.
Fredrickson's job is to be ready to support patients in any way and anticipate how they will react to provide the best possible care.
The emotional well-being, the physical well-being, social, practical, there's so many different concerns and problems that can occur when somebody's entering into a cancer journey.
Fredrickson says the support groups help relate patients with their struggles and help cope with their feelings.
I think sometimes for our patients to be able to talk with somebody who says, yes, I get it. I've been there before. I felt that way before too. I don't know if it normalizes that process, but it definitely connects them with somebody where the feeling of going it alone may not be there anymore.
The support groups meet in person and virtually with other patients or a patient's family. While diagnosis is one challenge to overcome, treatment is another that can put a serious toll on a patient physically, emotionally, and mentally.
If you're used to a certain level of functioning and feeling well and doing all the things you need to do, that can have a really negative impact on how people feel about themselves or how they're doing or being productive or being active.
Fredrickson ends with some tips to keep a patient's mental wellness. Seek support, express feelings and concerns, use the resources available in your area, look for positives through it all, and look for what you can control.
Cancer is usually unexpected. It just comes out of nowhere and leaves people struggling to find their footing and learn how to move forward and cope. So it can feel like there's nothing in their control. So I think sometimes looking for those things that we do have control over, how we cope, our emotions, how we find support. Those are some things that we can control.
I think support groups are, you know, lots of different support groups out there, some of which are online. But they can be such a valuable part of protecting mental health and helping people through difficult things. What input do you have on that?
As with anything, we want to make certain that the providers of those services have the correct training and are doing things that are evidence-based, that they're based on research, that are going to be helpful for people. So whether it's online or a face-to-face group, we just want to make certain that those providers are providing the best possible care that is based upon research and evidence.
Yeah, I think that's an important point, is that not all support groups are going to be created equal. They can be an incredibly valuable tool, but not all of them are going to be as useful as others.
Yes.
Yeah. So, we have a question from Facebook saying that they're reading articles about needing to strengthen the connection to yourself and those around you. But what if being around people is draining because you're an introvert, Dr. Ermer.
Right. I mean, you use your judgment. I do think even introverts want to spend some time. You know, if let's say you have a hobby and you're an introvert, you might join the group that has a specific hobby, or even a spiritual group. I think you do what's obviously an introvert. You're not going to want to be the life of the party, but you can find some social outlets that don't stress you out, I guess is what I advise. And that kind of, as going back to support group, there's official support groups we talked about earlier, but the other support groups are just community groups that you become involved in. That's very helpful too. They're not officially like mental health support groups, but having a community of people that you spend time with can be very helpful.
Correct.
Yeah, and I think that even introverts need some social connection.
100%.
Yes.
I know Obama talked about being an introvert and people laughed because no, he likes, but he obviously did well socially also.
He did pretty well.
Yeah.
I would add to that, even as an introvert, if they take the risk of being in a group of other people, even if they don't feel like they're contributing much, research clearly supports they receive some positivity from that, just by being around other people. Not just by osmosis, but they do receive something from it, and so do the other people. Sometimes an introvert doesn't want to be in the other group because they think that the people will judge them harshly because they're not saying anything. But research clearly supports that quiet person that's in the group is often the strongest and the most important member of the group, especially if and when they speak up and say something.
I have a partner like that. He almost never says anything in our meetings, but when he says, everybody listens.
That's correct.
Yes.
And even physicians that are quiet, and guess what? They listen to their patients. Some of the people I've talked to, their patients, their favorite physicians are the really quiet ones who sit there and listen, and then have, like you said, they have a few words of advice that are very powerful because they've taken all that information in.
Correct.
Yeah. So here we have a person who's concerned because their child washes their hands a lot since the pandemic. At what point is this a problem, or when should they talk to their doctor about it? Dr. Ermer, this is right in your bailiwick.
Sure. No, I think it's a problem if it causes extreme distress for the child. A good example, if they're not allowed to wash their hands, and let's say you're in a hurry to get to school and they just can't let it go and they cannot stop the anxiety and the stress level, then it's a problem. If they wash their hands to the point where their hands are chapped, I think the biggest thing is going to be how much distress does it cause? Do the teachers notice it at school? Do other people notice it too? And really how much distress is it causing for the family and the child? And then if it's causing distress, then I'd certainly seek professional help.
And if their hands are
Right.
torn up and bleeding because they're washing them so often.
We know a lot of people. Yeah, there's people who have lots of, the normal human condition is some people probably should wash their hands more. And some people, are on that end of being very cautious, and it's all within normal range. But if it starts causing immense distress, then it's a problem.
Okay. Here is a clinical question. Somebody wants to know what the best mood stabilizer for anxiety is. That's a medical question. I'm going to throw that one to you, Dr. Ermer.
That's probably impossible to answer. It's individualized, and probably not use a mood stabilizer for anxiety. Typically, you'd use an anxiety medicine, but I would hesitate to give advice just based on that much information. I absolutely, if you're asking that question, I would encourage you to see somebody who's got some expertise in the area to really go over your history, your symptoms, go over maybe what you've been tried on before, and really have that conversation on what's best and what's.
I think, like a lot of things in medicine, there is rarely a single best.
Yeah, there is not.
There are a lot of options and a lot of different factors that go in when we're deciding what medicine to prescribe to somebody. And we all have our favorites, the things that if I don't have a reason to use something else, I'm going to use this one first. But there's no single best.
No.
So.
I'd add something else to that, is if individuals are feeling like medication is the primary intervention that's going to help overcome their depression or anxiety, that's just one piece of the puzzle insofar as interventions. You also need to consider what we're talking about tonight, is those coping skills and self-care and spirituality and exercise and diet. Those things can play as significant a role as a medication intervention might.
And sometimes Those things, particularly combined with counseling, are sufficient. But don't be afraid of medicine.
Correct.
Medicine is so important, and sometimes medicine helps you get to a point that those other things can take over.
That's a good
and
point.
you know, I'll often tell people the medicine can get you to the point where you can learn what you need to learn from counseling to address those anxiety issues and to learn those new habits and those new thought patterns.
That's a great point.
You know, they all have a role.
Yes.
Absolutely.
Yeah.
And just going back, if, for instance, we thought the person washing hands truly met the criteria for obsessive compulsive disorder, there's great studies that show that therapy probably is a better starting point than medicines, because you get those long-term coping strategies, but medicines also. Frankly, a lot of studies with depression, anxiety show that combination initially can be some of the best.
Yeah, I always try to convince my patients, let's do both.
Mm-hmm.
Let's do both.
Mm-hmm.
We have a caller from email wondering what are some of the symptoms of depression. Dr. Jackmon.
Well, you think of a major depression, you generally have 9 criteria, and you're looking for somebody that had meet 5 of those 9 criteria. But some of the symptoms would be sleep or appetite problems, poor concentration or decisiveness, obviously suicidal thoughts, mood, irritability, things aren't fun anymore. We call that anhedonia. The things they used to enjoy just aren't really giving them much pleasure anymore. Any like agitation or psychomotor retardation, meaning being really slowed down and fatigued, loss of energy. Those would be the primary things I would look for. More days often than not for a period of time.
Anything to add to that?
I would just
Dr.
add,
Ermer?
sometimes with kids, irritability can be so these are the kids who are throwing tantrums or getting in fights on the playground. So for kids, probably more so than adults, the irritability can be the only symptom we see for depression. But I agree that low motivation, low energy, moods down. And those are the times where, you know, we were talking about where the exercise is great, but if you're having serious depression, then you need to get professional help.
Someone from Sioux Falls is wondering if an 8-year-old could be taking Prozac.
It's approved for 8-year-olds and studied and has good evidence.
So the answer is
Yes.
For the right child with the right indication,
Right.
Prozac is a very good medicine.
It's the most studied, frankly, in children and adolescents.
Yeah.
Or fluoxetine would be the generic name.
Fluoxetine's right, exactly. So we have a caller who's wondering if anesthesia, presumably general anesthesia, or pain medicines can affect their mental health. Dr. Jackmon.
I'd probably defer to physicians
I don't
on that
believe
one.
anesthesia, if it's just for a procedure, typically has long-term lasting impacts on mental health. Pain if we're talking about narcotics, we generally feel that long-term narcotics are not great pain management tools, and so they can affect mental health. And I think a goal in most pain clinics is to lower those doses and get off the pain medicines, because they're just not good long-term solutions.
Yeah, and there gets to be a chicken and an egg situation
Right.
with those medicines, and with pain too. So it's a very difficult situation, but yes, in my experience, they certainly can. So we have a caller wanting to know, and this is a good question that's changed recently, if Medicare covers mental health services. Dr. Jackmon, that's been a change in your field recently.
Yes. Yeah, I believe they've increased the amount of individuals that they'll serve and cover for mental health services. So generally speaking, most providers are going to accept Medicare, and they've expanded what they'll cover.
Yeah, it used to be that only people with certain degrees could be covered by Medicare. Physicians, MDs, DOs, yes, but in terms of psychological treatment, counseling, therapy, they had to have certain degrees, and they've expanded the number of degrees that they'll cover. So
which is awesome.
It's amazing. It really is going to improve access for people with Medicare. So we have a caller who wants to know about nutrition and how that can affect your mental health. I'm going to throw that to you, Dr. Jackmon.
I'm sure we've been preached that for the years, for decades, about how important nutrition is. Yet I think it's just become even more profound how important it is as related to our mental health. Again, it's the mind-body connection. And if you put bad food, bad ingredients inside your body, it's going to affect your thinking and your cognitive abilities. And so that's something you could work with a dietitian, with your primary care physician, someone that has some knowledge around that. And I think another one is water. Just drinking, here I'm drinking coffee, but having enough and caffeine, that having enough water intake. There's good studies out there that support the importance of people having enough water in their system.
Taking care of yourself, whether it's sleep, exercise, nutrition, I mean, those are really important things.
And I would avoid there's a lot of, if you go on the internet, going back to the internet, there's a lot of fad diets, and I think, and I, again, talk to a nutritionist or your primary care doctor, but most are just recommending a well-balanced, just a well-balanced diet, not to go down some real faddish kind of diet.
Right.
Restrictive diet or something.
Exactly, and I think that's a challenge because a lot of people will use those fad diets and can develop eating disorders as part of that. So yes, lots of fruits and vegetables, whole grains, lean proteins, minimum salt, minimum sugar, the basics.
South Dakota diet.
Yeah, right. Fabulous. And speaking of South Dakota and rural health, according to the National Rural Health Association, farmers are over 3 times more likely to die by suicide than the general population. To address the unique stresses associated with farming, Avera Health encourages any farmers who are struggling to call the Avera Farm and Rural Stress Hotline and seek help when needed. Carl Elke of Avera Medical Group Psychiatry shares more about this important hotline.
The main resource that I think the hotline offers is first a gateway to mental health help if that person is wanting that, and also education. A lot of times folks are naive to mental health help or don't know how to access it. So one of the big things that we offer is an avenue to try to help people learn that. We also help set folks up with help if they're looking for it. We can do that in a multitude of different ways, but one thing that we often ask folks is where would they prefer to get that help? Some folks aren't comfortable getting help at their local primary care provider's office or in their hometown. So are they more comfortable getting help through Avera's telehealth system or in a different locale? I will say we see some common themes, probably the first one being financial concerns, whether that be fluctuating commodity prices, insurance and input costs, livestock illness, unexpected repair costs, those types of concerns are one. A second one would be unpredictable and oftentimes devastating weather events. Just the last few years we've seen drought, floods, derechos. We didn't even know what that word was a few years ago. A lot of folks are comfortable going to their local pharmacy for their diabetes or their cholesterol or their antihypertensive medications, but picking up a psychiatric medication induces a significant amount of fear and stress for them. We have partnered with our pharmacy here at the Avera Behavioral Health Center. We'll send stuff through the mail for them just to avoid that and help ensure that they're taking that medication and help with compliance and hopefully get them feeling better. One of the biggest things that we've tried to champion since we started the hotline is to encourage those folks that you see needing help to get help. Pride and the mental health stigma still prevent a lot of folks that need help from getting help. A lot of cliches over the years have been used, especially with mental health, whether it's pull up your bootstraps, throw it under the rug, rub some dirt on it. Those types of statements need to stop, and we need to get folks in for the help that they need and they can benefit from. I tell folks it's the producer themselves or anyone that has a concern about a loved one or has questions. They can call in to help either get that person facilitated into getting an appointment, or they can just ask questions and get some education that they can then pass on to that person in hopes that that turns into a phone call later. Our hotline is staffed 24 hours a day, 7 days a week by licensed mental health counselors who are trained in assessing that person's immediate needs, if they're any acute danger, if they're actively suicidal, but then also facilitating setting up whether it's psychiatric appointments or counseling appointments, whatever that person would prefer.
it's so exciting to see these things being developed to help people in our community, and I really have to echo that and encourage anyone who needs that help or who recognized anything and thought, maybe I should call.
Absolutely.
Do it, reach out, get that help. So we've got a lot of questions. I'm just so thrilled to be seeing all these questions coming in, but we don't have much time left, so let's get to them, gentlemen. All right. We have someone who wants to know if there are any new psychological or pharmacologic treatments for alcohol.
Wow. Yes, there are, yet some of them are still in the formative stages as far as determining if research suggests that they're appropriate. So I'm being really careful about answering that on air. I think I'd just go with the tried and true things right now and consult with a psychologist or psychiatrist or family care physician to see what's available in the community that does have good grounded research.
I'd agree. There's some really exciting research going on right now, some fairly new drugs, for
new medications,
that really seem to maybe reduce the craving, so they would be a game changer again, I agree with Dr. Jackmon. I'd hate to say that because they really aren't approved yet, they aren't studied, but could be some exciting stuff coming in the next few years.
Well, and depending on, when I was in medical school, it was all about antabuse.
Yes.
We're going to give you something that makes you puke and feel horrible if you drink and think that that's going to help, and it really didn't help very much. But look at naltrexone, and I think that is something that's got some good data, and that I've had wonderful success in helping people reduce their cravings if they're interested in. And certainly we've got a lot more addiction care and addiction care beds and treatment and things. So there are a lot of good options out there that we wouldn't have had 10 years ago. So don't be afraid to reach out.
Absolutely, and there's just great research and ongoing studies because we're talking 10% of the population.
Yeah,
and
huge.
So I think 20, 30 years ago was sort of, I'd like to say, the Wild West. You'd go to a different you'd get a totally different treatment. Now we're really looking at those programs that really do have the evidence.
Yes, so a lot of research, a lot of exciting things. So here's a caller who's wondering about counselors that work with patients who have chronic diseases, and how would they find those services? How could they get hooked up with someone who does chronic disease work?
I'd start with a primary care physician. You could also call our Avera. I forget the actual number of it.
Google.
Yeah,
Just go to the internet.
Yeah, no.
It could be a positive.
Google Avera.
I'd call Avera because they have triage
Behavioral.
folks that can point them in that direction.
Behavioral health navigators that can help you get hooked into services that are evidence-based.
When I would say a lot of the places that like cancer centers, they have some people they work specifically with because it is such a big issue with chronic problems. So you could even talk, if you have a chronic illness, talk to that person providing care for the chronic illness. They might have someone that actually works with them.
Absolutely. Chronic pain is a great example of that too. So good. Here's someone who is embarrassed to go to a therapist in their small town. How about telehealth mental health appointments?
Yeah, that's a great question because there's few providers in some of our rural areas, so you're left with folks that are in your community, and confidentiality is a problem because everybody see your car driving up to that building. So I could understand how that would be difficult for individuals. If it's possible to drive to another town and it's not too much of a financial burden, I'd encourage face-to-face. Now that's my personal belief. There's some research that supports online therapy can be as efficacious or helpful as face-to-face, but a majority of the research is going to support the face-to-face connection is going to be extremely, extremely important. The same would hold true though if you choose to go to the online. You want to make certain that provider has the credentials and has the experience and is giving you suggestions or advice or interventions that are appropriate for your problems.
I think too, some therapists will do both. So sometimes you can do a initial visit or every other visit, or have a combination of that, face-to-face and telehealth.
Yes.
So, and your primary care provider can sometimes help you find the right person, or the triage, behavioral health triage can help you with that. This is a good question. Someone on Facebook is wondering about cognitive behavioral therapy, what it is, and how it can help.
That is so funny. I just trained technicians this afternoon in the hospital on CBT. I redesigned the whole CBT programming for our
CBT
facility.
being the abbreviation
Being cognitive
for
behavioral therapy. And whoever's asked that question likely is aware that it's one of the best therapies. There's over 500 different therapies per se for treating people, but cognitive behavioral has been shown to have the most promise and helpful for folks with anxiety and depression. And so simply put, it refers to whenever you hear the term cognitions, it refers to a person's thinking, and so it refers to how a person's thoughts connect to how they feel, and how they feel connects to how they behave, and how they behave connects to their thinking. So if I'm thinking I'm going to completely bomb this talk tonight, that's going to make me feel anxious, and then when I feel anxious and nervous, and I might spill my coffee all over myself, and I think, boy, they're going to think I'm an idiot. I don't know what I'm talking about. And so I have to think positively that I'm going to do the best that I positively can. That makes me feel a little bit more confident, and then I'm going to act a little bit more calm. So simply put, thoughts, emotions, behaviors, how they're interconnected.
And how important it is to help yourself break that this is going to be horrible and I'm going to do
Correct.
Terrible and I'm not going to,
Yes.
So
But I have to be able to recognize what I call stinking thinking. That I have to recognize the negative thoughts that I have and try to change those.
Perfect. So, a caller wants to know. And this is something that we were talking about a little earlier back in the other room too. A caller asking about mental health advocacy for people that are incarcerated.
Oh, that's a great question, because I mentioned earlier the prison system tends to be one of the biggest provider of mental health services in the United States. There's a lot of mental health, and almost every prison or even jail offers mental health services internally, so you have access if you're in prison.
So, and it is definitely something that is very needed.
Absolutely.
And it's needed all over, but especially that population has particular risks, particular stressors, almost always some kind of trauma that they need to address. So it is definitely something. Are there any places we can go as an individual to say, this is important and we need to advocate for this population to get the help that they need? Are you aware of any groups that are working on advocacy?
I'm sure there are. I think just contact I think the good news is from a political point of view, there's bipartisan support for better mental health services. It's not something they're debating, so I do think the time is ripe to advocate for better mental health services, because everyone agrees we need increased services.
So definitely something worth contacting your legislatures about. All right, we've got more than we can get to, but we'll go quick here. Someone says they have pathological demand avoidance in children, and has it been recognized in the U.S., and are there people available to help provide treatment? Dr. Ermer, is that something you can field a question?
It's not well defined. Currently, they've associated with autism spectrum disorder, where these kids are given a demand and they just fall apart. I do believe it's been recognized as an issue in kids. They just haven't specifically labeled it. So you can still see a child therapist who can work on these kids who are having behavior problems when you do give them demands, but it's not, how should I say, it's not in we have a book called the DSM-4. It's not officially recognized as a separate diagnosis. We think it's part of problems that kids have.
Okay. And let's get to this one here. A caller asks that they see more information about suicide awareness coming from my child's school lately. Why is it on the rise in our teenagers? And this is another topic we have been discussing a lot. Dr. Jackmon.
Why is suicide on the rise with our teenagers?
Yes, suicide awareness and suicide.
Well, I think it's great that schools are providing that service. it's important that they develop even peer support programs. As you know, teenagers tend to listen to their peers more than they listen to adults. And so having that type of programming in the school system can be extremely beneficial and helpful. Why that's on the rise, I believe there's many more stressors. Social media might play a role in that. Drug and alcohol and substance abuse might play a role, but I don't think that's a new thing. I think it's just more recognized now, and it's something that we're able to talk about more openly now. Mm-hmm. But that population, the young population, has always been one of the higher groups of having suicide.
Anything to add, Dr.
No,
Ermer?
I'd agree. I think the rates are up. It's a very complicated, multifactorial issue. I don't want to pick on the social media and the internet, but I do feel a lot of people studying it do feel it plays a part. There's been some studies that shown that kids who spend a certain number of hours on the internet have a higher risk of suicide. You know, it could be a chicken egg. You know, maybe they're isolated because they're down. But the point is, we've the internet
is not always your friend.
Exactly.
Thank you, everybody. The winner of our prize tonight is Peggy. Thank you, Peggy, for asking a question during the first 20 minutes of the show, and a gift will be sent to you. We'll be back after this.
On Call with the Prairie Doc has been a leading source of health education for 21 seasons. Join us as we continue to provide health information based on science, built on trust. Follow us on Facebook, Instagram, and YouTube to access the entire Prairie Doc library today.
During our most recent family movie night, we watched one of my favorites, Encanto. At one point in the movie, a character who has been gifted supernatural strength confesses that she fears she will crumble under the weight of all that is expected from her. Although she accomplishes amazing things, it never feels like enough. She never feels like she herself is enough. Popular culture suggests she should prioritize self-care, which is usually represented by manicures or massages and long soaks in the tub, or perhaps half an hour of meditation or spin class. Now, to be clear, I'm a big fan of massages and getting my nails done, and I spend a lot of my professional time nagging people about exercise, as my patients can certainly attest. But I'd suggest this perspective on self-care is at best incomplete. Protecting your mental well-being goes well beyond little escapes and even beyond tending to your physical health. The specifics of true self-care are unique to each individual because each individual is unique in their needs, their desires, their circumstances. You simply can't meditate quality daycare into existence, or a nasty coworker into a team player, or a loved one into sobriety. Self-care, meaningful self-care, means being able to recognize that you are human and you have limits, and that it's not just okay, it's critical to acknowledge and respect those limits. The demands vying for your time and energy are endless. Those resources, however, are not. True self-care means standing up for your right to be the one who decides how you will allocate your time and energy. This means setting boundaries, and that's an incredibly difficult thing to do. With those limits will naturally come guilt, because you simply can't do everything for everyone, or even all the things you yourself want to do. No one else can decide where your lines are, and no one else will hold those lines on your behalf. In order to hold those boundaries, you must be kind to yourself. Most of us have a perpetual self-commentary of criticism that tells us we could do better, we should do better. we aren't enough. Honest self-reflection is important, but why does that so often mean a laser focus on where we fell short without recognizing how far we came? We internalize the message that if we can't keep up with demands that escalate until we crack, the fault is ours. It's not. To draw those boundaries and make that self-compassion meaningful, we each must clarify our own values. Spending our limited energy in ways that conflict with the ideas we hold most dear is the antithesis of self-care. We need a clear idea of what those values are to hold that line. Massages and meal delivery services can be great tools, but the real key to protecting your mental well-being is a lot harder to define and a lot harder to do. Thank you to our guests, Dr. Ermer and Dr. Jackmon, for volunteering their time to help us learn more about mental health. If you would like to see and hear more episodes of this program, please like and follow us on Facebook, Instagram, YouTube, and TikTok, or visit us at prairiedoc.org. Look for Prairie Doc Perspectives in your local newspaper and online, and listen to us live most Wednesday mornings at 9:30 on KBRK in Brookings. And be sure to look for the podcast of this program, Prairie Doc On Call, wherever podcasts can be found. From all of us here at On Call with the Prairie Doc, thank you for joining us for another episode of health information based on science and built on trust. Until next time, stay healthy out there, people.
The heart beats about 2.5 billion times over the average lifetime, pushing millions of gallons of blood to every part of the body. When the heart stops, essential functions fail. Prioritizing your heart health. Next time on Call with the Prairie Doc.
My name is Tom Dean. I'm a volunteer board member for the Healing Words Foundation. I grew up on a farm near Wessington Springs. Actually a farm that was only a few miles from where my great-grandfather homesteaded, so our family roots are deep there. I went to high school in Wessington Springs and then to Carleton College in Minnesota, and from there to medical school in Rochester, New York. Access to health services is quite limited, so the Prairie Doc activities allows people to have contact with medical professionals from a variety of disciplines. The uniqueness is the fact that it's independent, it's not associated with any of the various competing forces that sort of control health services today. It's objective, independent, and I believe reliable. I think having access to health information that people really do trust is a tremendously valuable service, and that's true whether you're in the prairies of South Dakota or the middle of New York City. For more information or to donate, head to www.prairiedoc.org or send your donations to Post Office Box 752, Brookings, South Dakota 57006. Thank you for your support.
Major funding for On Call with the Prairie Doc has been provided by
Out here, the day starts early and ends late. You don't love this land because it's easy. You love it because it's home. At Avera, we're built for rural healthcare. We're bringing quality, innovation, and advanced technology to your vibrant communities. Care when and where you need it. That's how Avera moves health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Ophthalmology Limited, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health, Dakota Dermatology, Vance Thompson Vision, Black Hills Medical Society, Brookings Madison Flandreau District Medical Society, Pierre District Medical Society, Sioux Falls District Medical Society, Yankton District Medical Society, Orthopedic Institute, Aberdeen Asthma and Allergy, South Dakota American College of Physicians, Cool Beans Coffee, Lake Poncet Sailing Academy, and Swiftel Communications.